For more on this, we're now joined via Zoom by Dr. Mary Stephen, who's a technical officer for the WHO's regional office in Africa. Dr. Stephen, thank you very much indeed for joining us. How alarmed should we be hearing that there's a new strain that is actually quite mutated?
Thank you for having me, and good evening to you and to your viewers. Yes, this new variant that has been detected in both Botswana and South Africa, it's something that is concerning to us, given the fact that, one, it's new and it has high number of mutation on the spike protein, and we are not sure whether this is going to evade immunity. We are not sure whether the transmissibility is going to be high. So definitely this variant is of great concern to us. And we are continuing to monitor with the team that is currently in South Africa, the genomic sequencing team, and engaging with government to do more investigation on these new detected variants.
I know that the continent, different countries are differently resourced, and not all of them have the capacity to do this genomic testing and sequencing. Could that mean there are other variants that are floating out there that we don't know about?
Yeah, capacity for genomic sequencing in Africa has been limited, but we have made progress. We are currently not where we were before. We have seen some significant progress in terms of enhancing capacities of countries, but definitely we still have more work to do. And the fact that country is not testing properly or not testing very well, it's possible that, of course, we might be missing some of those variants that might be of interest. But the thing is that we need to continue to enhance these capacities, because it will be helpful, not just for COVID only, but even for future outbreaks.
All right, so you're monitoring South Africa and Botswana. It's still early days. How long typically does it take for you to start to get an understanding, A, of its transmissibility and the efficacy of vaccines against it?
Yeah, I don't have specific like time limit for you, but it's going to take a lot of looking at how this virus is evolving, actually, a bit of time and the information, and also continue to do more sequencing in these two countries that will help with understanding of the nature and the characteristics of new variants in terms of how transmissible it might be, or it might even evade immunity. So it will take a bit of time, but of course, with more information, more effort, then it to fast track that process.
I suppose in the meantime, you've got a better chance without knowledge of being vaccinated than not being vaccinated.
Sure, vaccine is always very good when you're talking about the issue of prevention. It's the first preventive mechanism, vaccination. And the more people are vaccinated, it will reduce these chances of, variant popping up all the time. It was not long ago when we had this Delta variant from India that had spread all over the world. And now we are talking about another variant with high mutation. And of course, partly due to the kind of the coverage we have, especially in Africa. So yes, you are better off vaccinated than not vaccinated. So people, we are all encouraged to get vaccinated when the vaccines become available to us.
Do we yet have an understanding of why this virus is mutating and sometimes mutates significantly like this?
But it's the nature of viruses, actually. Viruses do mutate when they circulate among human population. And our best option really to push it backwards is to make sure that we have a population that is not vulnerable, meaning that we have larger proportion of populations that are vaccinated, so we are not vulnerable to contracting even the COVID itself, further spread. And of course, like we said, the variants do mutate when they move from one person to another. So yes, viruses will mutate, but we have a chance if we improve the vaccination coverage, as well as preventive measures as well. The very simple things we know of, wearing your face masks and keeping your distance away, avoiding mass gathering, because it moves with people. So if people are protected and they try as much as possible to avoid unnecessary interactions, that also contributes to spread of the virus itself and also the potential development of new variants as well.
All right, you're talking about vaccines as a preventative measure, but we're seeing countries in Europe that are highly vaccinated, North America, highly vaccinated, recently now seeing a surge in COVID-19 infections. Why is this happening, and what does that mean for us, a continent that's still quite low on the vaccination path?
Yes, okay, so let me take a step backward.
Yeah.
The vaccines for COVID-19 specifically, they are supposed to prevent severe infections and therefore reducing the number of hospitalizations and reducing the way our health system will react to it. So meaning that our health system will not be overwhelmed, but also continuous evolution of the evidence is still ongoing, but we know for sure that it prevents severe disease and all the issues that I talked about. So now going back to these cases in Europe, we know that there has been documentation of breakthrough infection, but this is not what is even driving the infection. Majority of the infections are seen among the vulnerable unvaccinated populations that they have. But if these infections is happening among people that are vaccinated, then it means that those that will end up in the hospital with severe disease is going to be much, much lower than what we have seen. So the health system may be able to cope, but if you have people that are not vaccinated completely, then the chances of having severe disease and getting the health systems overwhelmed is very, very high.
So what does it mean for Africa then? Because we're still really at the sort of beginning stages of vaccination programs. And so are we vulnerable to a lot of illness and perhaps deaths if these new waves come aggressively? Yeah,
so my simple answer is yes, we are vulnerable. Because we have a large proportion of susceptible people, meaning that people that are not vaccinated, so they don't have any form of immunity against COVID. While we continue to ramp up the vaccination campaign, we have seen some improvements in the vaccines. We are not where we want to go, but definitely we are far from where we started. So in addition to the vaccine, as we continue to mobilize, also take care of the issue of hesitancy and vaccinate as many people as possible, we need to observe the preventive measures. They do work. Even as somebody like me, I'm fully vaccinated, I still wear my face masks whenever I'm going out, and I also make sure that I avoid unnecessary mass gathering. So it's important that we still observe or comply with the preventive measures as we continue to ramp up the vaccination campaign. We have seen it works, but the problem is compliance. So we need to use all the tools available to us to limit this transmission.
For the fourth and sometimes even fifth waves that look like that they're on their way, if not some countries in them already, which regions, which countries are you most concerned about?
Okay, so for the new wave, I think I would say all countries in Africa, we are at risk of this new potential fourth or even fifth wave for the simple reason we have talked about the issue of very low vaccination coverage, the fact that the population is fatigued and they are not observing preventive measures, and now we are going into the festive season. A lot of travels will be happening, a lot of celebration. People will not respect the preventive measures. On top of the variants that we are talking about, Delta, and now new variant that we don't know whether it's going to be highly transmissible. So all these factors put together puts all the countries countries in Africa at risk. So even if a country is not there yet, does not mean that they are out of the woods. We have to make sure that we are vigilant and we continue to prepare for this wave, because surely it will come.
All right. How far are we in terms of vaccination? How much help are we getting? Because there was this issue of Africa not getting vaccines because the West were busy taking all the stock from the manufacturers. And we've set up these interventions and programs to try and alleviate that. Are we seeing any fruits coming through?
Yeah, for vaccination, we have surely made some progress. So far, the continent has received over 320,000 doses. We have administered over 228,000 doses, and now we are almost about 100 million people that are fully vaccinated. So if you look back, let's say even September or October, we were not this far. But we have moved, we have made some progress. So we are almost around 7.3% of the continent. So we have seen increase in the amount or the quantity of vaccines we have received on the continent. And so we need to make sure that these vaccines we have received are administered, reducing the issue of hesitancy in whichever way possible, to have all these vaccines administered while we continue to mobilize for additional doses.
All right, and coming back to the variant, the conversation that starts where we started, Botswana, South Africa seem to have identified this variant, but also Hong Kong. How does that play out? Must be travel. The connection between Botswana and South Africa one can see, but Hong Kong?
Yes. So we always say that public health threats have no borders. They have the capacity to move around the world, and travel is the mechanism by which they do that. And I usually add that they do not need any visa, because no immigration officer can identify them. So yes, when people move around the world, they carry these viruses. And of course, this new variant, the specific case of the traveler in Hong Kong, the person said to have had a history of travel to South Africa, and then he was detected while he was on quarantine in Hong Kong. So you can see that the way we are moving around the world, the risks is there because of the way the whole world is interconnected. And we know this fact is very well known. And that is why we are saying that no country should be left behind, because we are all in this COVID pandemic together. If you leave one country behind, we will continue in a vicious cycle. So the need that we carry everyone along and we tackle this pandemic together is very, very important.
All right, and perhaps finally, the South African and Botswana authorities will be meeting with your organization in the coming days. What do you need to know?
Yeah, so basically the details, the information on these new variants, and of course the way it is evolving. So it means that additional new cases that are being tested, we have to increase the number of sequencing that we are doing, because we are not doing sequencing for all 100% of cases. So we have to increase that and continue to monitor for potential evasion of the immunity, and also how transmissible it is. If, for instance, within a very short time, like we saw with the Delta variant, that majority of the cases that have been sequenced are now this new variant, then it tells us that something is happening with the transmission. So all this information is important to tie every evidence that we have, and definitely even tomorrow WHO is going to be meeting. So potentially we might have a name for the new variant, as we have had for the Delta variants and other variants, Alpha and Beta. And then additional information, definitely it will help in understanding the situation better and determining the potential effect that we are afraid of.
Dr. Mary Stephen, thank you very, very much indeed for your time, and let's hope that this variant isn't one that will escape the might and the power of the vaccine.
We hope so.
Yeah, thank you so much. Thanks for your time.